In this video, we will go over a C7 anterior corpectomy with C6 to T1 ACDF for decompression and resection of an eosinophilic granuloma. The patient is a 10-year-old girl who presented with right-handed weakness and clumsiness. Imaging demonstrated a collapsed C7 vertebral body and instability with an enhancing mass. Therefore, it was elected to take the patient to the operating room to perform a corpectomy with resection of the tumor and decompression of the nerve root with instrumentation and fusion. After induction of anesthesia and intubation, bilateral upper and lower extremity SSEPs and motor evoked potentials are set up. The C-arm, which will be used for localization, should be placed as rostrally as possible to be out of the working space of the surgeon, and the operating microscope should be draped during the beginning of the case. The neck is placed in gentle extension, and in this case, the C7 vertebral body is localized. A horizontal skin incision approximately 1 inch in length in the Langer lines of the neck is marked out. At this point, the area over the right side of the neck is shaved, prepped, and draped in a sterile fashion. After the initial incision is made with a blade, dissection is carried out with the bovie cautery through the platysma muscle. The DeBakey and Metzenbaum scissors are used to dissect along the anterior border of the sternocleidomastoid muscle, anterior and medial to the carotid artery down to the anterior spine. The anterior spine is cleaned off with a peanut. Fluoroscopy is brought in to confirm the level, which is marked with a bent spinal needle inserted into the disc space. The shadow line retractor system is used for gentle retraction, and the bovie cautery is used to clean off the anterior spine, including the bottom half of C6, all of C7, and the top half of T1. 2 distracting posts are placed in the body of C6 and the body of T1, and 3 clicks of distraction are used to distract the interspaces. The operating microscope is then brought in, and the 11 blade is used to cut a window into the C6, C7, and C7 T1 discs. Curettes and kerosene instruments are used to perform the discectomies down to the level of the dura. At this point, the Lexel and kerosene instruments are used to remove the C7 body and then perform the corpectomy. All of the remaining disc down to the level of the dura is removed, and the foramen are decompressed bilaterally, in this case paying special attention to the patient's right side where she had a root compression. Once the correctly sized plate is put in place, fluoroscopy is used to confirm directionality and placement of screws prior to placement. Once drilled, tapped, and locked, AP and lateral fluoroscopy is again used to confirm final placement. The wound is copiously irrigated with antibiotic irrigation and then closed in layers. 3 ovicral inverted interrupted sutures are used to close the platysma, as well as the deep subcutaneous tissue. A running 4-0 Biasin subcuticular suture is used to approximate the skin edges. Benzoin, steri-strips, and a sterile dressing are applied.